Hi, this is Dr. Nilesh Bangalore. I am here basically updating you about COVID 19. I had done a blog about a week ago, and there are a few new things that have happened. So, the first thing is, what is the status of COVID 19 as of today? We have identified more than 2 million patients now across the world. The mortality rate is still around 6.5%, which is not a big change. In Italy, the mortality still remains at 13.1%. In the USA, it is at 4.4%. In New York, it is at 5.3%. And in California, it is at 3.2%. These numbers have not changed dramatically, and that is good. We just wish that they go lower. The second thing is about treatment of COVID 19. Just a few days ago, FDA urgently approved something called as a blood purification device. It is almost like a dialysis machine, but not exactly. It purifies the patient's blood, and a substitute has to be replaced. So it takes so-called blood with a lot of toxins out, and the rest is returned with the hope that patients improve. The second is remdesivir, which I talked about last time. And there is actually a study published in the New England Journal of Medicine. 61 patients received this intravenous drug. Most of them were very sick. And in the patients who were on the ventilator or who required extremely high doses of oxygen, there was a significant improvement after receiving this drug. The mortality in the very sick patients was only 18%, as opposed to the expected 50 to 70%. And in the patients who were not so sick, mortality was only 5%. So it seems like a promising drug, but still it has to prove itself. Clinical trials are going on. The third kind of treatment is called immune modulators. There is a drug called tocilizumab. This is a drug that has been used in patients with rheumatoid arthritis. It basically contains the immune system, and since we believe that sometimes the immune system can actually make the patient sicker than the problem, this medication may be of value. We have some anecdotal experiences with patients improving after they have received this medication. Again, it has to prove itself. The fourth kind of treatment is called convalescent plasma. This is where patients who have recovered from COVID 19 infection generate antibodies, and these antibodies can be collected as a part of collection of plasma, and that can be used to treat other sick patients. And in China, there was a study done where 5 patients who were on the ventilator, very sick, received convalescent plasma, and all of them were able to get off the ventilator. Those patients also received steroids and some antiviral agents. Details are not available, but again, this could be a very promising treatment. And I therefore urge anybody who has recovered from COVID 19 to at least go to the blood bank and donate their blood. Their plasma may save somebody else's life. And the last treatment is called ECMO, ECMO, which is extracorporeal membrane oxygenation. This is basically like a heart-lung machine for patients who are extremely sick and who don't have a functioning lung. There was a recent report of a patient who was deathly sick, required this ECMO treatment, and actually survived. So there is hope in the horizon. The third thing I wanted to mention was something called as a COVID-19 hospitalization tracking project. This has given me a lot of hope. This is done by University of Minnesota, and they are tracking all the hospitalizations across all the states, number of patients in the ICU, number of deaths. And there was one graph that I wanted to show you, and this basically represents New York. The top graph shows you number of patients that are admitted to the hospital for every 100,000 of the population. And as you can see, initially there was a straight line and now it is curving. If this was not changing, you would see these dotted lines. So clearly we are changing the curve. That means less patients are getting admitted to the hospital, which will translate to less deaths. The graph at the bottom shows us of all the patients that are in the hospital, what percentage are COVID-19 patients. And again, initially, it seemed as if the number of COVID-19 patients were increasing quite dramatically, but now we see this curve again, another example of the flattening of the curve. I hope that this trend continues. I continue to follow this project and will update you in one more week. The last thing I wanted to talk about was something called as testing for COVID-19. As you all know, the most common test now is the PCR test. And what it does is it actually detects the virus. All the commercial laboratories now have this test. And if somebody wants to get tested, they can go to the CDC website, answer a few questions, and they get an idea about whether they should get tested or not. You could call your primary care physician or call the local hospital or the local county agency. The second test that is really exciting is called the antibody test. This test does not detect the virus, but it detects the after effects of the virus. We believe that patients who get infected with COVID-19 make antibodies that are protective, and those can be detected as a test. The way this helps us is we can monitor large populations to determine how many patients may have had this infection while being completely asymptomatic. And if somebody has an antibody, it is quite likely that they are not infective. It might help us with this whole social distancing situation, and we might be able to allow certain groups to mingle based on whether this test is positive or not. I really feel that there are hopeful things happening, and that in the next few weeks, we should see that translate into clear benefit in terms of decreasing the death rate. I, of course, want to thank every healthcare worker who goes to work every day and does the best for taking care of patients. I will talk to you again next week. Please stay safe.